highlighted, John Paul for JP, Bagala, Technical Officer, Safe Motherhood at the Ministry of Health. So when it comes to such conversations, we get very, very excited to be in your midst. But today, I'll put on another hat to see how we can sail through today. We welcome all our guests who have come from within and from far. Thank you very much indeed for joining us. We welcome our various regional colleagues and partners who have worked with us this journey. Thank you very much indeed. It's been such a very interesting journey. And as we've seen in the video that has been running, we cannot underestimate the impact of the work that has been invested through our partnership. We thank you very, very much indeed. At this juncture, ladies and gentlemen, I want us to set the ball into motion and allow me invite Dr. Fred Semitala, the Executive Director of MJAP, to give us an opening prayer. Dr. Fred.
Thank you, JB. Good morning, everyone. Let's humble ourselves for a word of prayer. Precious Lord, we want to thank you for a new day. We want to thank you for the gift of life. We appreciate you for everybody who is in this place, wherever they have come from. And Lord, we also want to appreciate you for the energies and efforts that you've given us and the teams that have been working under the RHITES EC for the past many years. We commit the new project, the new activity, the UHA activity, that Lord, it will make a new difference within the continuum of care, that we will improve the lives of people living with HIV and other health challenges. We thank you for these opportunities that we come together, to work together to improve the health of Ugandans. We pray all this through Christ our Lord. Amen.
Thank you very much indeed, Dr. Fred. Now, ladies and gentlemen, with God in our midst, we are very sure that we're going to sail through today quite successfully. As you can see on your respective agendas that are right before you, we want to know who's in this room, who has managed to join us today. And we're going to have a round of introductions, but we are going to do that in groups. Thank you. So do we have the team in the room from RHITES EC? Team from RHITES EC, you could stand up for recognition. Thank you very much indeed. Thank you, RHITES EC. Thank you very much indeed. Thank you. And I know this is a team that supported phenomenal work in the Busoga region. Do we have any representatives from the regional referral of Ginger in that region? Dr. Yai. Yes, you're most welcome indeed. Any colleagues from the districts of Busoga? Colleagues from the districts, EC? Thank you very much indeed. Please, feel free to stand up and wave to the rest of the people in the room. Then we have RHITES Southwest. Team Southwest. Most welcome indeed. Most welcome indeed. Do we have any team from Intra Health in our midst? Very powerful. Thank you very much indeed. And a team from North Lango. Thank you for joining us. And a team from URC. Team from URC, very powerful. Thank you for joining in. The Uganda Health System Strengthening Activity. Any person, any representation from UHSS? Thank you very much for joining. USAID MCHN, representation from USAID MCHN in the room. Thank you very much indeed. Malaria reduction activity, powerful. Thank you for coming. Family planning activity. You're most welcome, thank you for coming. Social behavior change activity. Thank you very much indeed. Any colleagues from UPMB in the room? Thank you for representing. Then we have the sites. Any person from the sites? Thank you very much for coming. USAID ICANN. Do we have any person from USAID ICANN? Thank you. USAID local partners. Thank you for coming. As we can see, we have reconvened as a family that has been supporting through comprehensive partnerships to improve our healthcare systems. It's quite very clear, very clear. Our theme, we are looking at working together to build a resilient and sustainable health system in Uganda. Resilient, sustainable, and responsive. And a team from Baylor, powerful, thank you. Acholi, powerful, thank you. The G2G, thank you very much indeed. Have I left out any teams that are already here? You could just stand and I bring the microphone right before you. Any team that I've left out? And you're already in the room. Very good. Very good. So, ladies and gentlemen, allow me invite my colleague Moses to take us to the next item on our agenda. Moses.
Thank you very much, Dr. JP. I think you've done a wonderful part there. Selfishly, allow me to recognize some of our local country teams that are here. Some time back, I was a member of staff at MJAP. That's MJAP. Yes, Dr. Semitala who led us in a word of prayer. We thank you and thank you for steering MJAP. Of course, we have TASO, the AIDS Support Organization, TASO teams that are here. We thank you so much for your presence. We have JCRC teams. Yes, thank you. Well, very welcome. Of course, there's my sister Anne, CDFU. Thank you for being here and for being at the helm of young people and being vibrant. I won't forget EGPAF, the EGPAF family that is here. You're all warmly welcome. Of course, we have HQ teams all the way from the United States. We have URC teams. Thank you. You're welcome. We have JSI. Thank you for being here. We have IntraHealth. Of course, they had been introduced a little earlier. So ladies and gentlemen, once again, allow me to let you know that we have this program being telecast live, and the hashtags for today are sustainable health systems, and the next hashtag is resilient health systems. Feel free to log in, share the hashtags of this wonderful event as we work together to build a resilient and sustainable health system in Uganda. Without much ado, allow me to invite Dr. Edward Bitarakwate, who is the grandfather of the USAID RHITES projects, because it is USAID RHITES Southwest that is the oldest of all the RHITES programs. As a grandfather, I would like you to come and welcome our guests and partners here. And I'll request that you'll introduce the video that will be showcasing the USAID RHITES project story. Please, let's welcome Dr. Edward Bitarakwate.
Thank you very much, Moses. Ladies and gentlemen, today is a good day. It's a day that speaks of a journey that started in 2015 and is ending now in 2023. Good morning, everyone. You're all most welcome to this learning event. They call me the granddad because we started the very first RHITES mid-November 2015. Today, we are going to share with you that experience of one of the most complicated, integrated health activities implemented by USAID in Uganda. We broke new ground, but also made several strides in leading Uganda's health system to be stronger, more resilient, but most importantly, impacted the lives of millions of people. Today, we'll be sharing that journey with all of you from the Ministry of Health in all your protocols and responsibilities, with USAID, but also with all the stakeholders we've worked with over the years. We have leaders from the local government, both administrative as well as technical, civil society, beneficiaries, but most importantly is all of us who have together contributed to the successes that we are seeing today. You know, we're going to watch a video, but you'll also have access to some of the legacy documents. The RHITES portfolio of projects that span from the southwest to the northeast. RHITES Southwest covering 2 regions of Chigezi and Ankole. RHITES EC covering the Busoga region. RHITES EC was implemented by URC. RHITES E covering the Bugisu region and stretching to the northeast as well, in certain instances, was led by IntraHealth. RHITES North Lango by JSI, and RHITES North Acholi by URC as well. Together, these mechanisms reached over 18 million people, Ugandans, with HIV counseling and testing. That's a huge proportion of the Ugandan population. When you look at the global HIV targets, all regions closed out in the 90s. We basically surpassed the original 90-90-90 targets. That means lives saved, but that means a walk in the direction of taking Uganda to a prosperous and healthy country. For prevention of mother-child transmission, over 98% of the women have access to it today. And we've seen the related drop in new HIV transmissions from mother to child. 86% of the people who started TB treatment completed it. While we still have a huge TB burden, we are not where we were in 2015. Family planning coverage increased significantly, with over 3 million couple years of protection being dispensed, and that's a critical journey to manage our youth bulge, which is a dividend, but to also help families make informed choices. Maternal mortality has plagued Uganda for a long time. And over these years, we've seen institutional maternal mortality drop significantly. And so is newborn mortality. Most importantly, we've seen special emphasis on young people, with the DREAMS programs reaching over 400,000 adolescent girls and young women with HIV prevention packages, but also livelihood programming that will undoubtedly make them less vulnerable and usher them into a world of empowered young women who will contribute to national development. On the side of technology, digital health, we saw the introduction and expansion of electronic medical record systems. Over 500 facilities have high-quality data systems that have now become the mainstay of the Ministry of Health's quest to digitalize its systems. Infrastructure has been improved significantly in the regions, with millions of dollars spent to improve the quality of services being provided. I can go on and on, but the most important thing is that all this has been achieved with the generous support from the American people and the hard work of the Ugandan people and all other nationalities that have contributed to this journey. So without further ado, welcome again. It's a time to share and learn, but it's also a time to celebrate. It's an end of an era, and later we'll hear how that's ushering us into the next phase of strengthening our health system. Thank you very much, ladies and gentlemen.
Thank you, Dr. Edward, for that bird's view of the story of the USAID RHITES projects. Ladies and gentlemen, as we warm up for the video, I see some faces here that have been pivotal in line with our theme of today. I see Dr. Cordelia Katurebe, please, you're very welcome. Thank you for making time to be here with us. I know you've been very instrumental in pediatric health service delivery with Ministry of Health. We have Mr. Dan Wamanya, who is here with us. Mr. Dan Wamanya, thank you for being here. I remember the first time we traveled together with Madame Alicia Musa in Karamoja, her first time to travel to Karamoja, and she had a wonderful experience. We appreciate your being here. I will not forget the Deputy Chief of Party for the USAID RHITES North Lango project, Dr. Pamela Dongo, who was the Deputy Chief of Party, and the project was successfully closed and transferred, and we thank you. Of course, we have Dr. Augustine, who has been at the center of organizing and coordinating, of course, having been the chief of party of the USAID RHITES EC. That's the Busoga region, and I am very confident the footprint that was left is amazing. Of course, let me also recognize Dr. Tindiewa, who is here with us. We appreciate the work that you do with young children. He's a pediatrics expert and the ED, Aneka. Thank you so much. In our midst, we have local governments that have been represented. Local governments from Western Uganda, that's Ankole and Chigezi. We have local governments from Busoga, from Bukedia, from Mbale side. We have from Karamoja region, Lango, Acholi, and we are so happy and excited to be here. So if you're from the local governments, I'd like to request that once again, please can stand up for recognition for the collaborations that we've had with the USAID RHITES projects. All right. Let's welcome the teams that have braved the journey to be here with us. We appreciate and we don't take it for granted that you could create space within your busy schedules. We have regional referral hospitals that have been well represented. We saw Jinja, of course we have Mbarara, we have the regional referral hospitals. Kindly, if you could please stand up. We have Mbale, Soroti, Moroto, Lira, Gulu, Kabale, Mbarara. Thank you for being here and for supporting our cause. I am going to invite Dr. JP to kindly come and mention a few of the members that are here. And also to remind us, if in case you want to get online, the password is 40002. That's for Speak Resort Munyonyo in the conference hall. There's Wi-Fi. And for purposes of, house rules or guidance, if you'd like to use the places of convenience, you'll use the back door and move in the corridor. About this area, you'll find the places of convenience that you can use. We still have a registration going on. If you've not registered, please register yourself as we prepare to enjoy this wonderful, wonderful day. The online team or the guests that are online, I hope you're following and sharing the program as it is flowing, and we wish and look forward to having an excellent time with you. We'll have some changes on the program, so please do not be worried when you see some changes. These are meant to see that we have a well-coordinated function that is on time and that is organized. Dr. JP, please kindly come as we prepare to load the USAID RHITES story. Thank you.
Yes, thank you very much indeed, Moses. Ladies and gentlemen, we continue to thank you for coming. And as Moses has highlighted, we have a very powerful representation from the Ministry of Health. Colleagues from the Ministry of Health, thank you very much indeed for coming. Dr. Dithan from Baylor, your presence in this room is quite very, very phenomenal. We have incredible representation from various USAID activities that have joined us as well. But very importantly, ladies and gentlemen, we have our distinguished guests from the USAID mission, colleagues from the USAID mission. Thank you very much indeed. Thank you very much indeed. Your presence here means a lot. The amount of effort that you put in to ensure that this entire machine runs is very, very valuable. We can't thank you enough. Thank you. Colleagues, allow me also recognize the URC president, who is here. Thank you, thank you, thank you very much. Thank you for your presence, but also for the support over the years. We can't thank you enough. Colleagues, allow me also recognize the presence of the EdgePath Regional Director, and the team from EdgePath. Thank you very much indeed. Your presence here is extremely, very, very valuable. Colleagues, also allow me recognize the presence of the Intra-Health Chief Technical Officer in the room. Thank you very much indeed. Thank you. And also the JSI Director at the International Division. Thank you, thank you, thank you very much indeed. And as we've indicated, that this is a joint USAID RHITES, USAID UHA. Can we see the team from USAID UHA? USAID UHA, who are taking on this bull by the horns. My brother Alan, yes, Dr. Bitarakwate, yeah, the team from USAID UHA. We have, I think, wherever you are appreciating the task that, that is right before you. But there is a lot of support that is available for us to ride on to ensure that the successes that have been reached by USAID RHITES are just carried forward. The key issue here is the ability for us to sustain and ensure that until the point when the system is sustainable, as the URC president was indicating in his video, the system should be sustainable, the system should be resilient, the system should be responsive. Until that point, we are still in this journey together. Moses.
Thank you, Dr. JP. Would like to let you know that in a short while we'll have a video and that story will be coming through. But before that happens, we'd like to put the face to the story. We'll also be having a video that will be moving through the gallery for those who missed it, just for about a minute or two. But right now, allow me to invite the engines that were behind the USAID RHITES projects. I'll start with the grandfather, and I'll invite you to come over for the USAID RHITES Southwest project, Dr. Bitarakwate, to please come here. I would like to invite the RHITES EC, which will be led by Dr. Irisu, to please kindly come through. And the project was supported by Mr. Dan Wamanya. I'll also request that you come and join your team, because once the story is said, we would like to appreciate and know the faces behind. The USAID RHITES E project, led by Ndugu William Mubiru, please kindly come through. We have the USAID North Lango project that was led by my good friend Ndugu Medi Makumbi and Dr. Pamela Dongo. Please come through. We have Dr. Simwe, you'll be joining in as well as the technical support person from USAID. The USAID RHITES North Acholi. Please, let's welcome Dr. Ebo Nkolo to please come. These are the 5 RHITES projects, and there are engines behind them. With that, wanted to put them on the spotlight so that when the video plays, the successes are being made, at least we know the engine that is behind. Dr. Nathan was the chief of party for the USAID RHITES EC project. He started it. If you could please also come in, we want to appreciate you. You started the project and did a tremendously wonderful job. Right, so please, let's have picture taken of these gallant members. Oh. Pardon? Dr. Nathan Chiraga, please. Ethan Chiraga, please. Kindly, you're being summoned to come and take part in the evidence of the people that were at the engine. You've been humbly requested to join us.
think Dr. Sayum should also be because he was the name Dr. Sayum from USAID. Dr. who? Oh.
Dr. Sayum, I'm reliably informed that you also have to join in. Dr. Sayum, I've known him for a very long time. At some point, I forgot that he's from Ethiopia. I thought he was a Ugandan from Western Uganda. My brother, you're very welcome. To know that we've known each other for a long time, I even invited him for my wedding in the village. Unfortunately, he was out of the country. All right, so that's the team. We can give them a round of applause for a job well done. Thank you so much. You may take your seats. I'll request the technical team, the camera crew, to prepare a video and load it. The video that showcases the USAID RHITES projects, the 5 projects from North, Lango, Acholi, East Central, and Southwest. Enjoy.
Although Uganda has made great strides in health and well-being in the last 30 years, quality health services are still hard to access for many, especially the vulnerable and underserved populations. That's why in 2016, USAID Uganda launched the RHITES program to improve the health and well-being of 14 million people in 5 regions by providing integrated health services that address HIV, TB, malaria, maternal and child health, family planning, nutrition, water and sanitation, health system strengthening, and the COVID-19 response. HIV and TB are 2 deadly diseases that often coexist in one individual. In fact, TB is the leading cause of death among people with HIV. Using an integrated approach, the USAID RHITES program has been working to end these 2 epidemics.
Therefore, the USAID RHITES programs supported the Ministry of Health, the district local governments, health facilities and communities to improve access to HIV prevention and treatment services. We implemented health system fixes to increase access to HIV and TB services. We supported a robust laboratory service system to ensure access to HIV and TB diagnostic services, strengthening sample and results transport networks for timely clinical decisions. We also ensured integrated care, ensuring that clients living with HIV access other health services, and also clients in other clinics were able to access HIV testing services and linkage to care. As a result of all this support, the RHITES supported regions are on track to achieve the global 95-95-95 targets.
USAID RHITES program expanded access to family planning services to enable women and their partners decide freely on the number and spacing of their children, prevent unintended pregnancies, and participate in social and economic development activities.
We have worked a lot with the district leadership and also the community structures, and paying attention to the opinion leaders who have helped us to work with the community, particularly looking at improving the perceptions and knowledge around the family planning. We have also done integration of family planning services, especially at key points. This ensures that we have a one-stop care center where we have a wide range of family planning options, and therefore giving them opportunity to pick.
The number of women using modern contraceptives has increased by 40%. Unmet need for family planning dropped from 28% in 2017 to 18% in 2023.
We know that every woman has a right to access quality health care during pregnancy, childbirth, and after birth. So the RHITES program provided or improved maternal and child health outcomes by supporting the delivery of integrated health services. We were able to implement surgical camps, and these were mainly to help functionalize the health center force so that they're able to provide the critical comprehensive maternal and child health services. Another very important key impact issue was around remodeling and construction of our maternity theaters, but also the neonatal intensive care units.
In Uganda, 2.4 million children are stunted, and half of the children under 5 are anemic. The USAID RHITES program focused on preventing malnutrition, among children below 5 years as well as pregnant and lactating mothers.
We promoted routine micronutrient supplementation that included vitamin A supplementation, iron folic acid supplementation, and worming. We had targeted health education sessions for caregivers, and we're using multi-channel platforms. And the focus was on food preparation, hygiene, consumption of nutrition foods, balanced diet, and also integrated active case finding and support at both facility and community contact points for all interventions that were happening at the 2 levels.
The results of these efforts are impressive. Over 1.3 million pregnant women got iron folic acid supplements. Nutritional assessments were introduced as a routine practice in more than 800 health facilities.
So the USAID funded RHITES program implemented WASH interventions at facility and community level using the clinical approach, focusing on outpatient departments and maternal child health units. And that entailed assessment of water, sanitation, hand hygiene, healthcare management, cleaning and administration using standardized tools that we called the WASH scorecards. We then supported data utilization for action planning to address the identified assessment gaps. And when we went on to procure and build contactless hand washing facilities and positioning them at key contact points. We provided IPC supplies, and these included goggles, water treatment tablets, heavy-duty gloves, face shields, disposable aprons, medical gloves, gumboots, disinfectants, and hand sanitizers, basically to improve IPC practice at facility level.
USAID RHITES helped fight malaria, a big problem in Uganda. Many children die from malaria every year. In 2019, malaria killed 4,000 people and infected 13.4 million people in Uganda. USAID RHITES gave people bed nets to keep mosquitoes away and trained health workers to test and treat malaria, and it worked. More people got medicine to stop malaria when they were pregnant or young. Over 2 million people received preventive treatment for malaria during pregnancy or childhood. More people got tested for malaria fast and right. Over 4 million suspected malaria cases were tested using rapid diagnostic tests. More people got the best medicine to cure malaria.
So RHITES deliberately supported districts to map these hotspots, then conduct the test and treat outreaches. So the test involves identifying who has a parasite and then give them a full course of anti-malarials, and by doing that you clear the parasites.
Over 3 million confirmed malaria cases were treated using artemisinin-based combination therapy. RHITES improved the health system in 6 ways: service delivery, health workforce, information systems, medical products, financing, leadership, and governance. RHITES mentored health workers, fixed the supply chain systems, ensured quality care, upgraded infrastructure, enhanced data capture and analysis, and provided key equipment.
As a result of these, over 100 clinicians were seconded to public health facilities to support service delivery, and over 10,000 community health workers were trained and deployed, resulting into a vibrant community and facility networks.
So far, 100 plus clinicians joined public facilities to offer HIV services. 300 plus community health workers trained and deployed. 1,000 plus health workers' performance improved through HRH systems. 20 plus labs renovated to meet ISO standards. 20 plus facilities qualified for results-based financing. 200 plus district officials learned leadership and governance skills.
COVID-19 pandemic came midway the RHITES programs and the region and almost overturned the gains over the years. The RHITES program responded adaptively to ensure that the delivery of life-saving essential services continue, and some of the strategies that were used include training and mentoring over 10,000 health workers on COVID-19 guidelines and protocols, including provision of essential services amidst the pandemic. The RHITES introduced innovative approaches to deliver HIV services to the community, particularly reaching clients who were not able to come to facilities during the pandemic through home delivery. Resources were put together at district, regional, and working with the national teams. These resources that were mobilized were provided in kind to health facilities to be able to respond to the pandemic. With the support of district and community leaders, USAID RHITES program also supported rollout of COVID-19 vaccination. As a result of this response, over 60% of the eligible population were fully vaccinated in less than 1 year, and efforts are underway to integrate COVID vaccination into routine immunization services.
USAID RHITES also prioritized addressing social determinants of health and promoting human rights and gender equality. Through engagement with various groups such as religious leaders, youth groups, women's groups, and individuals living with HIV, they raised awareness, challenged harmful norms, and reduced stigma.
The approaches included interpersonal and group communication, mass media, including radio and printed material, and the free hotlines to provide information and get feedback and facilitate referrals. These were very key in addressing delays in seeking appropriate care and also reduced structural and socio-cultural barriers that led to increased uptake of services across the districts.
Notably, over 500,000 people adopted improved hygiene practices, 200 youth groups participated in health promotion activities, and 100 local organizations advocated for rights and gender equality. As USAID RHITES ends, we look back at some of the hurdles we faced. These include the COVID-19 pandemic affected over 170,000 people and caused over 3,600 deaths in Uganda by May 2023. It disrupted health services and reduced essential health commodities and drugs such as HIV testing and antiretroviral therapy.
HIV/AIDS stigma and discrimination remains high in some communities, affecting access to HIV prevention, testing and treatment services. There are still deep misconceptions, myths around family planning services. Women still have a need for spousal consent, and there are key religious beliefs that affect utilization of family planning services.
The USAID RHITES program utilized innovative and adaptive strategies to overcome challenges.
For example, during the COVID-19 lockdown and even after, the USAID RHITES programs ensured that people could still access care in places near them. USAID RHITES programs also address the social determinants of health and promotion of human rights and gender equality through advocacy, sensitization, and empowerment activities. USAID RHITES programs strengthen the collaboration and coordination among different partners and stakeholders through regular meetings, joint planning, and data sharing.
The USAID RHITES program learned valuable lessons that can inform future health interventions. Some of these lessons are putting people living with HIV and communities at risk at the center of the HIV response, helped over 1 million people receive HIV prevention, care, and treatment services.
The USAID RHITES programs use data from various sources such as MTRAC, DHIS2 to identify gaps, plan interventions, monitor and evaluate performance of health services. As a result, over 500 health facilities improved their data quality and use scores by applying data management and analysis methods such as data quality assessments, data review meetings, data dashboards, and the use of scorecards.
We celebrate our achievements in improving the health and well-being of millions of Ugandans. We have contributed to ending the HIV, TB, and malaria epidemics, reducing maternal and child mortality, and strengthening health systems. We have also shown the power of collaboration, learning, and adaptation in delivering quality health services. We have built a strong platform and infrastructure for other programs to build on. We thank all our partners and stakeholders who have supported us. We are proud of what we have achieved together, but we also acknowledge that there is more work to be done. We hope that the lessons and best practices from RHITES will inform and inspire future health interventions. Thank you for watching this video and for being part of this journey. Together, we can create a healthier Uganda.
Thank you so much, our technical team. As you can see, the story has been amazing. It's been a wonderful, wonderful story, thanks to the support of the American people. And I would like to request at this juncture, let's give a round of applause. The American people for the support. You know, when we say the American people, some of you do not appreciate what it means to get your taxes and send them to a foreign country, and then you wait to see services being delivered. Imagine with the taxes we pay in Uganda, if you heard that Uganda has sent money to a certain country, imagine how people would be here up in arms. But the Americans, with the generosity, say sharing is caring. So they send us cash, and these are the stories that come out, and we will appreciate our brothers and sisters from the United States for their generosity and support. Allow me to once again welcome you. I would like to also welcome Dr. Benson Tumwesije from Ministry of Health, and he's been supporting the UHA team. Dr. Benson, thank you so much for being here. I have my brother, my older brother, Mr. Alex Mugume. We used to work seriously together in Eastern Uganda when he was leading the STAR EC project under JSI. Thank you so much, Alex, for being here with us. I would like to let you know that we've had a slight change on our program. When you look at the program that we shared with you, there is break tea that is happening, but I think we've had the break about a few minutes ago. I think it would be unfair to us to assume that people are hungry after about 30 minutes. So we shall extend it. We are going to have our panel discussions. I'm going to invite Ruth to please come and take charge of this session. Ruth is our communications guru, and she's in charge of ensuring that we have a seamless panel discussion. The team online, please feel free to follow Ruth. You're welcome.
Thank you so much, Moses. Could we clap for Moses, please? Good morning, ladies and gentlemen. My name is Ankunda Ruth Shivena. I work for the USAID Uganda Learning Activity, and today I will be the moderator for the panel. Could you please turn to your neighbor and wish them a good morning? It's raining outside, we have had good coffee. Say hello to them, find out how they're doing. Great. Now that you have said hello to your neighbor, we would like to hear from the people that have been working with the RHITES. We would like to call them voices from the field. I will ask the people at the back to please put up the profiles of the panelists. So I will be introducing our panelists this morning, and dear panelists, when I call upon you, please come sit at the front. Our first panelist today is Dr. Yai Alfred, who is currently the director for Jinja Referral Hospital. Is Dr. Yai here? Please give him a mighty hand clap. Dr. Yai has about 17 years experience in clinical practice and public health. So he's definitely the right person to tell us the story of regional referral hospitals and how the RHITES can work with them. Welcome, Doctor. Our next panelist is one of the most important people that the RHITES have worked with. She's a DREAMS beneficiary. I think you're aware with the DREAMS initiative. Adon Kevin, if you could please come to the front with a mighty hand clap, ladies and gentlemen. She's one of the beneficiaries that has benefited working with the RHITES North Acholi activity. A young lady whose life has changed engaging with this initiative. Another hand clap, ladies and gentlemen. I think it's important to appreciate our beneficiaries. Now, the RHITES, as they implemented their activities, worked so much with civil society and other partners. Our next panelist is Brenda Apio. Brenda Apio is a dedicated healthcare professional and currently the programs manager of Child Hug Uganda. A mighty hand clap for our CSO partners that have really contributed to the work the RHITES have done. We know that the RHITES worked a lot and partnered with the local governments at the district level. Our next panelist is Dr. Siraj Masai. a district health officer from Kapchora district. He has traveled far to come and tell us the story of his work with the RHITES. He's an experienced health officer in disease prevention with over. Okay. So I think each panelist, you'll have about, I'll give you 7 minutes. I think I've added to the time since Moses graciously canceled our break tea. So you'll have 7 minutes to respond to the question. So I'll begin with Dr. Yai Alfred. And thank you so much for being with us here today, Doctor. So the question we're asking this morning is, we know that decentralizing health services is considered one of the most cost-effective ways to improve access to health services and build sustainable systems. So our question to you, Doctor, today is, how best can the local government leverage the technical support from the regional referral hospitals to strengthen service delivery at lower facilities and reduce the burden of referrals to second-level facilities?
Thank you very much, moderator. I observe the protocol, and I will go straight to the question you've asked. First, decentralization of health services, as indicated, is really the way to go if you want resilient and sustainable health systems. But before I tackle the issue of local governments, how best they can harness support from the regional referrals, I want to highlight a few of the existing opportunities that are working in favor of decentralized health services. Number one, we look at the legal framework we have in this country. The Constitution of Uganda, in Article 178, supports the idea of regionalization of government and the health and services, including, of course, the health services. If you look at the Local Government Act, it mandates line ministries, of course, including the Minister of Health, to support the local governments in terms of support supervision and providing oversight in services delivery. If you look at the national health policy, for example, also is in favor of supporting service delivery through the regional referral hospitals, especially the community health departments. So the legal framework is clear that we need to decentralize health services. Now, there are other opportunities. The other one is the regionalization agenda, which the Minister of Health is pursuing to make sure that health services at the regional level are centered around the regional referral hospitals. Already in line with that, the number of regional level strategies that are anchored at regional hospitals. For example, we have the local maternity systems, we have the regional quality improvement committees, we have the regional operational centers, we have the regional workshops, equipment workshops, and so on. These are all efforts to try to really bring down the services at a regional level. The other opportunity we have towards decentralizing health services is the regional level partners we have. I sit here representing the regional referrals that are implementing the G2G support, which is funded by USAID, the US people, the US government. On behalf of the regional referral hospitals, I really want to say we appreciate the American people for the support they are giving under the G2G arrangement, where there's a funding mechanism going direct to the regional referrals to support services in HIV/AIDS, TB, maternal child health, nutrition, and also related hub and spoke activities, where the regional referrals are supported to go down to the districts to support the service delivery at a district level. And then finally, you find the regional referrals have built capacity. They have technical capacity in terms of human resource and other capacities to be able really to support the service delivery at district level. So when you look at all this and come to the question of how best local governments can harness technical support from the regional referrals, there are a number of ways this can be done. Of course, number one, to improve the quality of services provided at district level, especially the lower levels, we need to look at issues of improving the quality of care through support, supervision, and mentorships. Already, as regional referrals, we already undertake support supervision, integrated support supervision, and also technical support supervision, and mentorships are being handled with support from the G2G. The G2G support already empowers us to go and do that, and on a quarterly basis, we are already doing that. And I think the local governments can benefit more by embracing this support and working with us closely to see that when our teams go down, they are able to deliver, they are able to support the facility teams to gain knowledge and skills to deliver better quality health services. So that's one area. In areas of human resource capacity development, we have the required senior level health personnel at the regional hospitals that can help one to do capacity building through on-site or clinical attachments. For example, right now what we do is we identify facilities, health center falls, general hospitals at district level that have probably knowledge and skills gaps. We bring those doctors to the regional level, we attach them there, they are mentored by these senior consultants and consultants at the regional level, and I think that's one way we are trying to ensure that the facilities at the lower level are supported with the right knowledge and skills to be able to deliver. But also we provide a resource pool at regional level. I know districts implement a number of capacity building programs. They have a number of trainings, but we have the required resource pool, trainers, TOTs. So the districts can draw from us at the regional level experts who can go down and provide training for their teams at a facility level. So that's another opportunity, another way they can harness this support. Then another one is through monitoring and evaluation mechanisms. At the regional level, we have capacity to access data through DHIS2 from the districts. So when we get the information on quarterly basis, we analyze it, and we are currently organizing quarterly performance reviews. And through these reviews, the districts have the opportunity to learn from others, also to compare their performance with other districts in their catchment area, in the regions, and learn lessons that they can implement to improve the quality of services they provide back home. Then the other area they can harness support is through equipment maintenance. Because for service delivery to happen, we need functional equipment that are well maintained and that are repaired when they break down. We have the regional workshops, and in these regional workshops, we have capacity in terms of human resource. Sometimes what we lack might be spares. So if the local governments can plan to procure spares and then engage our teams to repair the equipment and maintain them in a timely manner, I think that's one way we can ensure functionality of our facilities there. There are also opportunities of funding, because as a regional referral hospitals, we are a hub for coordinating partner activities and resource mobilization. Most of these rights, the rights teams that have been mentioned here, they have been supporting regional referrals to be centers of excellence, but they have also been using these regional referrals to coordinate service delivery at district level. So that is an opportunity that we can, the districts can benefit from. The rights issue, for example, has supported my regional referral, Jinja regional referral. They have done quite a lot, including refurbishing our laboratory. If you go in Jinja now and you enter our lab, you can have a reason to smile. And all this is done to make sure that at a regional level we have capacity to support the regions where we are in. So we appreciate the rights mechanisms, we appreciate the other USAID-funded above site and other mechanisms that are there to make sure service delivery is supported. Now we have Uganda Health Activity coming on board, and I know they are going to support the local governments directly, but they also be working through us at a regional level. And that's the one area where the districts can work with us closely to see that really service delivery at a lower level is supported. Finally, I want to say the advantage we have at a regional level is that the regional referrals are equitably distributed in this country. At least each region has one or two regional referral hospitals. And in that way, we can support the districts better. Other than relying on the Ministry of Health, with these expanded administrative units, Ministry of Health can no longer be able to reach everywhere. But since we are there in every region, I think we can be able to support service delivery at the regional referrals and at the districts up to the lowest facilities in a more efficient and more sustainable manner. Thank you very much for listening to me.
Could we give Dr. Yai a mighty, mighty hand clap? One thing I didn't say about Dr. Yai is that currently he's responsible and overseeing healthcare for 4.5 million residents in Busoga region. So you see that he has a very good understanding of how local government and others can leverage the regional referral hospitals. Thank you so much, Doctor, for your insights. Next, I think we should hear from our beneficiary, Kevin. And Kevin, I have about 3 questions for you, okay? Tell us about the DREAMS initiative, Kevin.
Thank you so much for inquiring. Madam Kevin Sande. I extend my greeting from the Gulu, Acholi sub-region. Actually, DREAMS is a short word that stands for determined, resilient, empowered, AIDS-free, mentored, and safe. It's a partnership that aims at reducing the rate of spread of HIV/AIDS amongst adolescent young girls and women and young women between the age of 10 to 24 years. Its main goal is to reduce the rate of new infections amongst adolescent girls and young women aged 10 to 24 years, mostly in the HIV-burdened countries with the highest risk. Actually, DREAMS, the main implementer of the DREAMS program is the USAID RHITES North Acholi, and these are the services some of the services that is provided by the DREAMS. We have HIV screening, testing, and counseling. We have the pre-exposure prophylaxis, which is the PrEP. We also have family planning. We also have income generating activity, which is the IGA, just to mention but a few. Thank you.
Great, thank you so much, Kevin. And it seems you are determined and resilient.
Yes.
So, Kevin, could you tell us what challenges were you encountering before you joined the DREAMS initiative?
Thank you so much once again. Actually, before I joined DREAMS, I faced a lot of challenges. The first, I didn't have any job because I wasn't involved in any income generating activity. My role was solely a stay-at-home mother, and my main role was maybe producing, because by the age of 20, I had already given birth to 2 kids. And I was only depending on my husband, and this led to several arguments and fights each and every day. I couldn't even take care of myself, because if you were to look at the Kevin once before then, and you look at this time, you see a very big difference.
Could we please clap for that?
So, actually, my main thing was the best thing I could do is producing, because for sure, at the age of 20, you having 2 kids, it wasn't an easy thing, and I couldn't even take care of my kids. Remember, I wasn't doing anything. So that was the real life I was in.
Great. And what has changed now that you joined the DREAMS initiative?
Oh, thanks so much. A lot has changed actually after joining DREAMS, because first of all, I got to know more about family planning, because back then I didn't know anything to do with family planning, and if it wasn't because of DREAMS, maybe at this time I would be having like 5 kids, because for sure the knowledge that I gained after learning about this family planning made me have that space. At least from then, after learning up to now, I can say I just gave birth to my 3rd child this very year. That is a space of like 5 to 6 years. Yes. My economic situation actually changed significantly because we formed a group called the God's Mercy just after Dreams came in. And from that group, we got resources, we got access to resources from the IGA, which was provided by USAID RHITES actually. So that's where we got our business as a group. And I personally, I ventured into selling clothes and fabricating saucepans. We also got training about financial literacy, and they majorly taught us about saving, of which I'm an active member in my group. So it helped me in saving, and at the moment I'm helping my husband take care of our kids, and as well as take care of myself. Yes. So this has led to significant reduction in the fights that we had before with my husband and frequent arguments, because I'm a useful person to him at this moment.
Great. Could we give that a mighty, mighty hand clap?
On top of that, I actually contribute a lot to the girls that I'm staying with, because I'm empowering them, like their well-being. Yes, through these services that has been provided, since I'm also a leader of a group, so I've empowered them, and I contribute a lot to these girls, because I'm like, all I can say is like, I'm a role model in the community.
Great.
Yes.
Wonderful, wonderful, yes. Wonderful.
My last thing I can say is I'm so grateful to the American people for their generous support. Thank you so much.
Thank you, Kevin.
Welcome.
And I think please visit the RHITES North Acholi. Kevin's saucepans that she fabricates are in the stall. Please pick one saucepan, okay? Let's support Kevin. Thank you so much. Now, like I said, the RHITES have also been working with civil society organizations. And I would like us to hear from Brenda. Brenda, how can civil society organizations effectively mobilize communities to demand quality services while also discouraging negative behaviors and practices that hinder access to healthcare service delivery?
Thank you so much, Ruth. Yes, thank you so much, Ruth. And ladies and gentlemen, I bring you sincere greetings from Lyra and from my organization, that's USAID Health Uganda. I am so grateful for the opportunity to participate in this insightful panel today. As we can wholeheartedly agree with me, communities are key in addressing their health challenges, and that is why they must understand their health issues in order for them to really appreciate their role in planning, in implementation, as well as in monitoring health programs. Civil society organizations, on the other hand, are also important key stakeholders in the health system because they help to strengthen access to healthcare services. They also support disadvantaged sections of society by ensuring that they have access to quality healthcare services. Ladies and gentlemen, it is based on these highlights that I would like to share with you today a few of approaches through which civil society organizations can use to effectively mobilize communities to demand for quality healthcare services, while also discouraging some of the negative behaviors and practices that may hinder them from accessing quality healthcare service delivery. The first point looks at civil society being able to play multiple roles. We are able to play multiple roles because we are born out of these communities. We live and work in these communities, and therefore this gives us the mandate to understand the community's health strength and challenges, and at the end of the day, we'll be able to mobilize them effectively to demand for quality healthcare services. As also civil society organizations, we have the mandate to foster a sense of ownership to the communities. We empower them we also ensure that their ability is strengthened so that they can be able to, advocate for quality and improve healthcare services. Ladies and gentlemen, civil society always facilitates community meetings or health campaigns so that they are able to, actively mobilize communities to actively give in their decisions that relates to health service delivery. Civil society organizations, on the other hand, can also mobilize communities effectively through engaging and involving the community gatekeepers. In this, I mean working with the local councils, the religious and cultural leaders, because they pass key information about specific health services that communities are entitled to demand and access. So at the end of the day, when we work with them, we will be able to make them appreciate and support communities to demand for quality healthcare services. Civil society organizations as well can effectively mobilize communities through a male involvement approach. We are aware of the gender dynamics in our communities and how gender inequality can affect and also, can make our communities forced to access quality healthcare services. But as Child Health Uganda, during our times of implementation, we worked with the men in our communities. And this was especially during the time when we wanted to increase uptake of family planning services. We created over 20 groups of men, family planning men, and we were calling them Imanzi Men's Group. And it successfully increased the uptake of family planning services among the women of reproductive age group in Kwale. Ladies and gentlemen, as I go towards conclusion, I would like you to also know that as civil society organizations, we can also form collaborations and partnership. And this will collectively make us to, leverage some resources, be able to share some expertise and knowledge to address health service challenges, which in turn can influence access to policy development that in the long run will improve a more sustainable quality healthcare services. In my conclusion, I would like all of you to know that as civil society organizations, we are also very essential in building blocks development and also in ensuring that quality healthcare service delivery is met. That's why we are in a better position to actively engage in advocacy and in service delivery, especially for the poor people and for the underserved in my community or in our communities. Thank you so much for the audience.
Thank you so much, Brenda. A better hand clap, ladies and gentlemen. One of the things that USAID emphasizes as we're implementing activities is the power of collaboration. And I think Brenda has clearly articulated how working with civil societies can support access to service delivery. We're almost coming to the end. Our last panelist, who is a DHO from Kapchora District, Dr. Siraj, thank you for coming from so far. Our question to you is, we know and have a good understanding that health service delivery is the responsibility of the local governments. So, sir, we would like to understand from you, what is the role of districts in working with the regional referral hospitals and other implementing partners to improve access to quality health service delivery?
Thank you, Moderator Ruth. That's my name, Siraj Masai, the District Health Officer Kapchorwa. I observe the protocol, and I want to say I'm here on behalf of all my other DHOs who are here in and those who have not entered here. Just as you have said, it's a loaded kind of question, and we may not deliberate on all the areas that the DHOs or local governments handle. I will zero down to key areas. As a health system, in this government, most of the service deliveries are decentralized. And when they are decentralized, it's by policy that the districts sit down and prioritize on key deliverable areas. In this delivery, we have the district council as the lead policy highest level, that TPC, that's the technical planning committees, where I sit as a DHO or colleague DHOs in rationing and prioritize the finances allocation. So in this situation, for the health services, I will look at more key area on the leadership and governance, which is part of the health system strengthening. Here we tend to utilize and enforce everyone to be accountable for their tasks under the districts, whether you are the political leaders, the heads of departments, the sub-county chiefs, the health facility in charges, the UMICs, that's health unit management committees, and the community themselves. That's the religious leaders, the opinion leaders, and cultural leaders. Through this, we sometimes handle it at our level as a district when capacity allows. But working with the partners, it has been key for us that we leverage on that potential, and we ensure that at the periodically, we tend to call these teams and engage them. First of all, we initiated, like for us in Kapchorwa, we ensure that these groups are brought up, taken through, build their capacity, and they know their roles and responsibilities, so that in the subsequent quarterly basis, we bring them periodically to revisit on their mandates. And this has tasked the leaders to own the health service activities in the district. One in the case is when you bring them, they will know that finances are not only for the roads. Sometimes the finances are not only for their sub-counties where they represent, but one facility like a health center 3 construction can give service to entirely everyone, since health has no borders. We have been able to bring up these teams in different forums. During the performance review meetings, we engage them. At the community, integrated community dialogues, outreaches, they participate. So like UMIC, they help us to mobilize the community. In charges helps us to run the services at the facilities and ensure that there's attendance to duty coupled with the SAS, that is the senior council assistants, and when it comes to the sub-county leadership, they know their roles. Mobilize the community at the same time, monitor at the facilities. So when you come to the district level, by the time you reach the district level and during the performance reviews, it is easier to track what we are targeted to achieve. And there is no apportioning blame to a DHO as the head of health in the district, but it is to everyone. So here we leverage on the potentials that we get from the Ministry of Health partners by apportioning ourselves actionable areas. If it is about community dialogues, I have the leaders, I have the health workers, I have the community structures, but what facilitates the process? A partner then comes in. So that harnesses the achievements. And I want to say incognito that so far, a lot has come down in this partnership in the area of leadership and governance. I want to go to issues like data use. When you call for a performance review, like our colleagues, the director had said, you are going to talk about M&E, reviewing, checking yourselves. What's the journey? Where are we so far? And partners have come handy in these areas. But I want to say during the performance review, we have been able to utilize data using different approaches, QI, involving everyone, and capacity building of these staffs. So the data that we tend to review informs decision making. And since you are bringing on board all the other stakeholders that you have engaged, they are able to monitor and see their facilities, how they are performing, how their communities are achieving, how the disease burden is going down. And I want to say this is embraced through the current capacity build in the health workforce that we have. The other is the HR itself, the human resource. I want to applaud government that, yes, there is a new structure which has been approved and health facilities. But you see, as we are pooling resources and harnessing support from the partners, government has done a lot by ensuring that the environment is secure, resources for infrastructure are put around, and equipmentation. Sometimes this might not be enough. And it's the reason we collaborate, we engage, we partner, and build support from partners, USAID, WHO, UNICEF, and several other agencies. I want to say specifically USAID to us as a district, and I'm very sure to all my colleagues, they have done a lot in building capacity of the human resource, and as well building our capacity to interpret the data and utilize it in apportioning resources like recruiting the critical cadre. For our case, when RHITES came, where we had midwives at 58%. As I speak now, through the data reviews and push, we are now at 84%. Of course, with the new approved structure, it pulls us down again. But that's, of course, a leverage and potential. When it comes to health facilities, apportioning resources for construction, yes, we had UGIFT, and at the same time at the district, we are given resources to apportion for infrastructural development. At the district level, it was easy to shout and show the figures and apportion the disease burden in those limitations. And now, we had 7 health centers, 3, but as I speak now, we have 12. And this is all of us are contributing in data utilization and capacity building. Of course, the key issue now on the human resource on our side is that the capacity that has been built in MNCH, newborn care, HIV, TB, nutrition, malaria, IPC, this is critical. I want to say I applaud USAID and all other partners for that, because already the capacity build will not be left out. These health workers are already changed from the behavior, attitude, and capacity that they had before. And that will remain as a sustainability achievement. The other area is when you look at maternal death, yes, by use of data, we were able to analyze our data and ask ourselves, how do we reach to these people who delay referrals in the community? Of course, we had RBF, which would support us, but unfortunately, it wasn't adequate. And that's where partners come. RHITES helped us in supporting the staff, facilitating the staffs to move to the referral communities, referring communities, have integrated and targeted outreaches in those communities. At the same time, building the capacity of the health workers in those lower facilities, so that we mitigate the causes of delayed referrals and sometimes bad outcomes of these deliveries. And this, I want to say, by the time they came, we had 9 to 8 deaths, maternal deaths in the region. I am very sure they are here, they will bear me witness. But as of this past year, we had reduced to 3. Of course, some deaths are inevitable. But I want to say reducing from 9 to 3 is a big achievement, saving like 7 mothers or 6 mothers from the other victims. So I'm just citing a few because I said time might not allow. A DHO's desk is to coordinate, plan, and allocate resources. So it is wide. I have just tried to pick on leadership and governance, maybe HR, data use, utilization. But I want to say it's enormous. The support is enormous. But with those achievements, I want to say that we are leveraging on the support by the CBOs, other IPs, like TB. We had a challenge. We were always the last because our rituals, people are pastoralists, and these were some of the challenges. But with the coming of RHITES, they supported us to build the capacity of the facilities, the laboratory, the sample collections and tracking. But as we speak, Baylor came in, and it's a good plus. Baylor having come on board, and it pulled us from wherever we were. Last quarter, we were #1 in the region on TB services and 8 nationally. So you don't take it for granted. It's wider, but I want to say it is obvious that we need to collaborate. We need also to learn from what we have already been having, and we sometimes throw other bad practices, but adopt the good ones. And so far, we have done so. Thank you, USAID, for accepting to work with us. But I want to say big thanks to government for ensuring that there is a secure environment and looking for us good friends like you. Thank you.
Thank you so much. Dr. Siraj, you took my last statement that I wanted to say, which is the RHITES have obviously been implementing with a CLA lens. They have been collaborating with the right partners at the right time for the right reasons. They have been using data for decision making and making the necessary adjustments, and which is what CLA is all about. Ladies and gentlemen, I'm going to ask you for one last time to please give our panelists a mighty, mighty hand clap. Thank you, dear panelists, for telling us the story of how the RHITES have influenced your lives. Kevin, we look forward to seeing you one more time, being here, leading another bigger group where you come from. Dr. Yai, as a regional referral hospital, we look forward to learning more and more about the insights that the regional referral hospitals can offer. Brenda, civil society is very important in this space, in the development world. We thank you for fostering ownership and engagement at the community level. And lastly, Dr. Siraj, as the DHO and representing other DHOs, we thank you for the work you are doing to ensure that services are delivered right down to the communities. Thank you, ladies and gentlemen. Our panel has come to an end.
Thank you. Thank you, Ruth. I request that our panelists, Ruth, please come and join your team. Would like you to have it on record that you led a wonderful, wonderful panel discussion. They should also give you a round of applause. You've done well. Thank you so much, the panelists and Ruth, for your job well done. I'd like to recognize Dr. Upentho George, Commissioner, Health System Strengthening, Community Health. Dr. Upentho, please, you're very welcome. Thank you for being here from Ministry of Health. I would like to inform us that we are going to have a health break for about 30 minutes, that we can have some tea, stretch ourselves, and come back for the second and last part of our session. We have the knowledge bazaar. As you're having the health break, as you're having a cup of coffee, please feel free to move through the various booths that have been provided so that you can see some lessons that have been mentioned here. You can also see some products that have been made. The materials that are there, please, we gave you some bags. The bags were empty, so that when you move around and you pick interesting material, you can place them within the bags. The materials are free. We also have a Q code where you can scan. They are on your tables where you can download the materials online. Trying to, as much as possible, have a paperless material sharing. So please, feel free to pick them. I'll invite Dr. JP. If there is some information that you'd like to share, please come and share it with us. But allow me to recognize the chiefs of parties for the local partner health service mechanisms. Mr. Moses Sarinitwe, please. Dr. Moses Sarinitwe, you're very welcome. We have, of course, that is for EC. We have Alan Lawino for Acholi. We have Abdallah Nkoyoyo for Ankole. We have Lawrence Mugumya for Kabale. Where is Lawrence Mugumya? Oh, yes, he's from my district, where I come from. He's not from my district, he's leading the district where I come from. Alex Mugume for Eastern, I'd mentioned Alex earlier. Thank you for being here. Francis Kazibwe from Karamoja. Francis Kazibwe. Thank you. You can stand up. Francis Kazibwe from Karamoja. Those are the chiefs of parties for the local partner health service mechanisms. Dr. JP, you'll kindly come through, and then we'll be going for the health break, and we'll be back for the final session. Thank you.
Thank you very much indeed, Moses. Ladies and gentlemen, we want to throw in 30 minutes for the break, for the health break. So if we can keep time, we've tried to catch up on time. At least we will be sure that we shall really finish on time. Allow me also recognize the presence of Dr. Nathan Tumwesije, the Chief of Party, USAID MCH and Activity. Most welcome indeed. Most welcome indeed. We had a prayer in the morning, and which was led by Dr. Fred. For those who missed that prayer, it was extremely phenomenal because it captured and was a blessing that really is going to transition us throughout the day. So we won't have a prayer for the health break. Could we proceed as we interact for the health break? And at exactly 11:15, we should be back here to roll on with the next part of the program. Thank you very much indeed. forward. So colleagues who are grabbing coffee, you can come in with your cup of coffee or tea so that you can listen in as we continue with the very important discussions that we are having today. Thank you. So, ladies and gentlemen, at this point in time, allow us to move to the next agenda item. With the program right before you, you can notice that we are going to have a series of very important remarks that are going to be shared by a number of individuals that have been at the center of the incredible performance we've seen from the RHITES headquarters. As we take our seats, allow me to invite the first speaker for this session, the URC President, Il Dust to give us his remarks. Il, most welcome indeed.
Yep, everything's fine. Great. Just give it a couple of minutes. Good morning, everyone. Good morning. Great. First of all, let me thank USAID for putting together this learning event. It's an excellent opportunity for us to learn from one another and learn from what we successfully had done in the rights activities and what improvements we can make going forward. I am from the Maryland office. We don't call it headquarters. We actually call Uganda headquarters because we have more URC employees and alumni here than we do in Maryland. So we are the support office, and we're back in Maryland. I had to fight to come out here because there was so much demand for coming out here to represent URC from the Maryland office. And I had the most compelling argument, and I won, and I'm here. And it's an honor for me to be here. So my compelling argument was, how all of us are development professionals, but how often is it that we get a chance to be involved in something from its inception to its successful conclusion? I have that honor. I was back in Washington working as the assistant administrator for USAID's Africa Bureau, and I remember the CDCS, the former CDCS, coming through, and we heralded it as an innovation across the agency. And that CDCS, built on a years-long study of data and interpretation of that data, came up with a simple storyline, and that is, we want our development assistance program, in partnership with local organizations, in partnership with the Ministry of Health and other government agencies, to focus on the 14-year-old girl living in rural villages. And all of us thought to ourselves, wow, what a compelling strategy. And also, in that discussion about strategy, the rights programs were discussed at a very nascent stage. And we thought to ourselves, how complex is this? To try and put together a nationwide, or mostly nationwide, effort and integrating multiple lines of health, stovepipe activities, integrated health. And I have to say that for me, coming into Uganda over the years, both with USAID and outside USAID, I think that it's been a tremendous success. I mean, obviously, improvements are needed, but what a success, and I congratulate you all. Also, we were concerned about, what about the competition, having divided it up into 5 different rights projects? Could we get the implementing partners? Could we get Mark? Could we get John? Could we get Philippe to work, and URC, to work together and share best practices and share information? And my observation is that it's worked very well. USAID may have a different opinion, having to manage all of us, but it's been, I think, a tremendous success, and it's also something that shows what the spirit of conviction, the spirit of development, getting all of our partners to work together. So I want to thank USAID certainly for giving us the opportunity to lead 2 of the rights projects, but I also want to thank EGPAV, I want to thank JSI, and I want to thank IntraHealth for being excellent partners. So I'm going to talk a little bit about what we know most, and that's the RHITES North Acholi and the RHITES East Central activities, which have been implemented by URC. Let me just start off by saying that we have a very strong commitment to Uganda. I've been with URC as president for 3 years. This is my 4th trip to Uganda, and as I say, we look at it as our informal headquarters. But we started working in Uganda in the 1990s with USAID and with CDC. I won't go through our long history, but I'll just talk about some of the projects that we had done with USAID successfully. The Quality Assurance Project, the Sustain Project, the HCI Project, the Assist Project, Defeat TB, and I know that we talked about the amazing results of the TB work done by both Defeat TB and the RHITES projects, but imagine unprecedented results in both detection, treatment, and prevention. So I congratulate all of you who are involved in that. So through these projects, URC has contributed to service delivery improvement across health areas, including maternal and child health, nutrition, water, sanitation, and hygiene, HIV, TB, and malaria. In both RHITES activities, as our other partners have done, we used an integrated approach to health system strengthening to improve primary health care delivery, increase utilization of quality health services and adoption of healthy behaviors, and to bolster district health systems. I know that you've had a chance. I'm not going to talk about the results that we've achieved. I think the booths that are out there for all the projects really speak to the accomplishments that have been achieved through the RHITES projects. But let me just say that in recognizing the work of our implementing partners, I also want to recognize the work of the Ugandan government and Ugandan implementing partners. Just the tremendous progress in health. Just 2 decades ago, life expectancy had plummeted to just 45 years of age, primarily due, of course, to the HIV/AIDS epidemic. Today, life expectancy has soared to more than 63 years, which is a significant accomplishment, and this attests to the commitment of the government of Uganda and also the PEPFAR program, which is implemented by USAID, CDC, and the Department of Defense, the US government's Department of Defense. So seeing such results and working with tremendous people, this is the work that really motivates me. And I know that it's the work that motivates you. But it also drives me and drives you to ask the question, what can we do better? What can we improve as we go forward? And so with the new UHA activity, we will take these lessons learned and innovations and apply them. So moving to the present and the future, I would like to thank USAID for trusting URC to lead its flagship health project, the Uganda Health Activity. I think we've put together an outstanding consortium of international and local partners. If I may, I'd like to call them out because they've done such a great job in Uganda over the years, and that's EGPAF, FHI 360, the Communications Development Foundation of Uganda, Youth Alive Uganda, the Marie Stopes Uganda, and the Panagora Group. We have a lot of work to do together. Please know that you've got my personal commitment and the commitment of URC to make UHA a successful activity and to improve the lives of the Ugandan people, but also keeping the eye on that 14-year-old girl living in the rural village. Thank you.
Thank you, Mr. President of URC, August. I just wanted to mention to you that just before you joined URC, I just left URC to create space for you. And when I was moving around, people said that we look alike, that we resemble. So I just wanted to let you know that I'm an alumni of URC, and we thank you so much for the leadership. URC has been in providing services for over 50 years. We celebrated 50 years about 2018, and I'm happy to be an alumni of that wonderful, wonderful institution. Ladies and gentlemen, I would like to mention that we have some very important partners here. We have the OVC USAID partners. The OVC USAID partners, if you're here, I'd like you to stand up a bit. You know, you people who provide a lot of support. Thank you so much for being here, and we appreciate your support. We have the TB partners, the local partners for health strengthening. We have the Infectious Disease Institute that is represented by Dr. Mary Mudiope. Thank you, Dr. Mary. Then we have Dr. Luaze, representing Dr. Stavia. We want to welcome you. I will also selfishly introduce a very good friend of mine from a very long time ago when we were in HIV health programming, Madame Robina Sempebwa, who is the Acting Deputy Office Director for Health and HIV. Robina Sempebwa, thank you so much. You've really shown that we can, as Ugandans, create an impact working with the American people. We have Mr. Dennis Nwagaba, who is the Acting Chief of Party for TPO Uganda. That is USAID Keeping Children Healthy and Safe Activity. And it is an OVC program in over 25 districts in central and southwestern Uganda. Thank you for being here with us. Ladies and gentlemen, I want to also recognize Dr. Augustine, who has been running up and down to see the success of this event. Dr. Augustine is the previously Chief of Party for the RHITES, USAID RHITES EC project, and we thank you for your dedicated service and commitment to the success of the USAID programs. In our midst, we have, as I mentioned, we have a number of DHOs, we have a number of local government partners, but allow me to sing out a few of them. There is Dr. Edison Tumusherure from Misinjiro, the border of Uganda and Tanzania, and I think and Rwanda. Thank you for being here, sir. We have Dr. Birungi, the DHO of Rwanda, Dr. Birungi. Thank you for being here with us. Rwanda is one of the new districts in southwestern Uganda, and that is one of the lead well-performing districts and a tourism destination. Dr. JP, I would like you to come and kindly help me welcome the next speaker so that we can proceed with our program. Otherwise, we thank you and appreciate you. And the online team, the people watching us from all over the world, we hope you are following and enjoying the successes of the USAID RHITES projects over the years. Thank you.
Thank you very much indeed. A round of applause to Moses, ladies and gentlemen. There is a team that is going around and giving us this very important booklet, which contains the entire story of the RHITES. Please ensure that you have it before you leave today. It's very, very important that when you go back, you run through to see the powerful story that we are talking about. At this point in time, ladies and gentlemen, allow me to invite our next speaker, and that is the HPAF Regional Director, Dr. John Ditekmena. Most welcome indeed.
Thank you very much, moderator, for the floor. This is a very great opportunity for me to take the floor and recognize the presence of high-placed people like the Permanent Secretary of Minister of Health, to thank USAID and all the mission staff, namely the acting USAID director, the rights prime partners, URC president and vice president, Intra-Health and GSI representative and other implementing partners and colleagues. Today is a great day, as my colleague Edward said this morning, and I just wanted also to echo what the URC president said. We have been sharing experience and we have been learning a lot. Someone said, knowledge is power. But knowing what we don't know is a superpower. That means we should be asking ourselves difficult questions to learn more, identifying new skills, determine new skills, develop them, and deploy them. So ECPAF is very proud of our collective achievement in improving the strength and resilience of Uganda's health systems and increasing the quality and equity of health services in 19 administrative units of Southwest Uganda. Over 8 years of regional health integration to enhance services in Southwest, ECPAF registers significant improvement. I'm not going to provide details, but let me point out some of those improvements. About 3.9 million women and men received family planning and achieved over 4.4 million couple years of protection. We have increased health facility institutional deliveries from about 55% to an average of 75%. The institutional maternal mortality ratio and perinatal mortality rate have been decreased significantly. About 200,000 key and priority population individuals were reached with HIV prevention services, including 29,000 adolescent girls and young women. About 500,000 of men over 15 years old received voluntary medical circumcision as part of HIV prevention. And approximately 1 million women were provided with the prevention of mother-to-child transmission of HIV, with a significant decline in MTCT from 4.3% to about 1.3%. Over 138,000 adults and children were initiated on life-saving antiretroviral therapy. With this increase, the HIV treatment made possible for us to achieve the 94, 98, and 93 on the 95 UNAID target. Ladies and gentlemen, I'm thrilled to see how Elizabeth Glaser Pediatric Aid Foundation, in collaboration with USAID and other implementing partners, will use the learnings for further improve Uganda's health systems through the Uganda Health Activities. ECPAF is committed to ensuring the support is provided to Uganda Health Activity, building on the legacy of the RHITES activities. ECPAF is honored to have pioneered the implementation of one of the RHITES mechanisms 8 years ago, and pleasantly worked with, well with all the other RHITES in 4 regions to achieve success. Elizabeth Glaser Pediatric Foundation is also pleased to have laid the way to transitioning TB HIV activities to local partners and regional referral hospital, and therefore working collaboratively with the university research company, John Snow and TriHealth International, and all other collaborators to ensure the process was seamless across the 72 districts in the 7 regions. EGPAF is committed also to support the implementation of USAID's country development cooperative strategy and the 2 USAID's goal approaches, the vision for health system strengthening 2030 and the vision of approach for localization. EGPAF appreciates long-time partnership with USAID spanning over more than 18 years in Uganda. The implementation of RHITES Southwest would not have been possible without generous support from the American people through USAID. We recognize the contribution of institutions and partners on successful implementation of RHITES Southwest. Therefore, I would like to use this opportunity to thank the following partner, but not limited to: African Medical and Research Foundation, Mayanja Memorial Hospital Foundation, or the PEPFAR implementing partners in Southwest, Infectious Disease Research Collaboration, Southwestern Uganda Regional Development Forum, Mbarara University of Science and Technology, all civil society, all RHITES Southwest sub-grantees and community health organizations, and the 9 district local government. The 2 regional referral hospitals, Kabale and Mbarara, frontline health workers, including community health care workers, and the staff of Elizabeth Glaser Pediatric Foundation in Uganda and across the globe, who worked hard to deliver results. Ladies and gentlemen, this is the opportunity for me to thank USAID, all the implementing partners, all the colleagues from EGPAF, and once again, thank you.
Thank you, Dr. John, for that elaborate presentation about EGPAF and the collaborations that you have made. While you are winding up your presentation, we had the honor of receiving the representative of the Permanent Secretary for Ministry of Health, Dr. Charles Olaro. We can welcome him with a he's been held up in a couple of strategic meetings, but he said he has to be here at this very important national event. Dr. Charles Olaro previously was the Director for Regional Referral Hospital of Fort Portal, and he's a senior consultant surgeon. So if you have any issues to be touched, he will look at you and know which knife to use on you. So he's a senior and is a Director Curative Services in the Ministry of Health. You're very welcome, Dr. Olaro. We also have Dr. Deo Lubowa, who is Assistant Commissioner in the Ministry of Health, the SCAP department. Ideally, that's the team that is tasked with quality assurance. Thank you so much for being here. It's called the SCAP department. We'll continue with our program, and we want to let you know, Dr. Olaro, that we've had an excellent exhibition, which we believe you'll also have an opportunity to go through. We've had a wonderful video, and I believe the team at the Ministry of Health will share a copy that you'll also share with the ministry management and the PS that you're representing. And right now, we are in the second half of our program, which is the remarks from the RHITES HQ representatives. We've had the URC president, Mr. Al Gast, who spoke to us, and just now, Dr. John Di Tekemena shared with us, is the EGPAF Regional Director. So let me request Dr. JP, you're very good with pronouncing these names. Please come and do the honors. Thank you.
Thank you very much indeed, Moses, and Director, it's a great pleasure to have you in our meetings. Ladies and gentlemen, in the interest of time, I request we roll forward. And allow me to invite our next speaker, Felipe Guinot, the Intra-Health Chief Technical Officer, to give us your remarks. Most welcome indeed.
Thank you. My name is actually quite difficult to pronounce, so apologies for that. Ladies and gentlemen, distinguished guests, I'm deeply honored today to be on this learning event on behalf of IntraHealth together with you. And we are grateful to have been associated all along with USAID and the government of Uganda through Ministry of Health to implement RHITES activity in 30 districts and two cities in eastern Uganda. Over the project lifetime, we have closely worked with Ministry of Health, local government, administrative units to increase availability and utilization of high-quality health services by strengthening health system, improving quality, access and demand to health services, but also addressing equity and reaching underserved population. Through championing different programmatic approaches, including district-led programming, data use, integration and application of digital solutions, the project has made great progress in terms of key health outcomes. I won't name them all, but we are extremely proud of what has been achieved together with the partners. The RHITES project has touched many lives, as evidenced by one of the beneficiaries, Mrs. Vicky Agejo, and she says, and I quote, "My first treatment was a smile." She says about the welcome she got when she first came to Magoro Health Center 3. She gave birth at the health center to a healthy baby. And she says, "I was surprised by the good service provision I got." Well, while Vicky's experience is a testament of the impact of USAID's support to people in their quest to access high-quality health services, no one should be surprised by the quality of health services. And as the theme of today's event is working together to build a resilient and sustainable health system in Uganda, RHITES, over its 6 years of implementation, has built a resilient system in eastern Uganda, and we can learn from this experience across the board. RHITES, with the government of Uganda, has worked to expand access to high-quality health services in 204 health facilities across the region and Karamoja, and aim to reach 7.3 million people with an integrated package of health services from HIV/AIDS, malaria, TB, nutrition, maternal and newborn and child health, family planning, and emergency health priorities. Won't list all the achievements there in strengthening the health system. There are so many, but a few of them include the renovation of 23 hospitals, setting up 2 regional emergency operation centers, the accreditation, the international accreditation of 4 labs in the region, and many more, leading to significantly improved patient access and health outcome. For decades, donors have funded vertical interventions targeting a disease, and while this played an incredible role in focusing effort and mobilizing resources, it lacks emphasis on health system strengthening and health system resilience. During the recent World Health Assembly in Geneva, and I'm from Geneva, ministries of health from low and medium income countries made it clear that they need and expect support in building resilient health systems, systems that are able to cater for the evolving needs of patients and also for future epidemic threats. The RHITES project offers us a concrete example of the impact of integrated investment we can have a system and access to healthcare. For this, I would like to thank the government of Uganda, USAID, all the implementing partners, and everyone involved in the program for developing such a wonderful roadmap and paving the way toward more investment in health system. I would specifically like to thank the regional referral hospitals and district local governments for their leadership in creating an enabling environment for these achievements. And I can't end, of course, without thanking the IntraHealth International team for their amazing work and commitment. We look forward to continuing working with you all closely in the future. Thank you very much.
Thank you very much indeed, Felipe. I think your communication has been quite clear. Director, what is resonating in this room is how collective effort is enabling us build sustainable and resilient healthcare systems. Through the activity of the RHITES that we are wrapping up today officially, but also flagging off a very important activity, which is the Uganda Health Activity, and with the support of a very powerful team from the USAID mission. So in the room here, we have very powerful representation from regional referral hospitals. We have directors who you continue to lead at the Ministry of Health. We have civil society. We have colleagues from UHA. We have local government as well in this room. So ladies and gentlemen, at this juncture, allow me invite our next speaker, and that will be none other than Mark Kowalski to give us a remark. Mark is the director for JSI from the International Division. Mark, over to you.
Good afternoon, everybody. It's hard to be last, and those are tough acts to follow. I'd like to just start by recognizing and thanking the Ministry of Health of the Government of Uganda, led by Dr. Charles Olaro, our friends and colleagues at USAID, led by Alethea Musa, who's an old friend, and I'm seeing her for the first time in 10 years. I had no idea she was here. Other distinguished colleagues from local government, Ministry of Health, including the district health offices, USAID, our implementing partner friends, and others. So thank you. So JSI's worked in Uganda for 37 years, building the capacity of the public, private, and NGO sectors, and managing public health programs focusing on strengthening Uganda's health system. We began working in Uganda through the Family Planning Logistics Management Project in 1985, and since then we've implemented dozens of projects in close collaboration with the Ministry of Health, district local government partners, and other important community stakeholders. Together, we've trained and deployed health workers, improved data collection and use, and expanded services to the people who need them. Our programming focuses on health system strengthening, supply chain, HIV, tuberculosis, reproductive, maternal, newborn, child, and adolescent health, and nutrition, malaria, and more. As a side note, one of the first tasks I was assigned after I joined JSI was a role in developing the proposal which eventually became the AIM project. So there's a through line. And that AIM project began in 2001. And later I had the pleasure of living and working here as the Deputy Project Director for another program from 2009 to 2013. It's really nice to be back in this wonderful country. I'm pretty sure then I didn't need glasses, and I'm almost positive I had more hair. So we've really appreciated at JSI, we've very much appreciated the opportunity to partner with the government of Uganda and USAID, and the commitment that you've demonstrated to strengthen health systems and improve quality service delivery for all communities, especially the most vulnerable. We're proud of our current work with RHITES, advancing nutrition, and the malaria reduction activity, and we look forward to future collaboration. JSI considers itself an organization that listens. We've learned a great deal through listening and through our collaboration with government partners, and I think the results borne out through RHITES speak for themselves. The RHITES North Lango project in Uganda strengthened the health system in the Lango sub-region to improve access and availability of high-quality health services for individuals and their families. This district-led and community-focused project strengthened health systems through improved quality and integrated health services, including maternal, newborn, and child health, HIV, tuberculosis, family planning, malaria, nutrition, water and sanitation, and COVID-19 vaccination. Some notable achievements include a nearly twofold increase in health facility births, surpassing the 95-95-95 HIV goals, and the creation of a youth and peer workforce to distribute critical health information and contraceptives to peers. We also developed a youth internship program that reinforced the health workforce in Lango. Many of those youth have landed permanent health positions after being provided hands-on job training and skills. In terms of infectious diseases, from 2018 to 2021, the RHITES North Lango project managed a large HIV and TB portfolio, which, as I mentioned, exceeded the UNAIDS 95-95-95 targets. Between October 2020 and September of 2021, the project exceeded the 95 target for testing of eligible individuals for HIV. All of those who tested positive on treatment, the project started all of those who tested positive on treatment, and 94% of whom are virally suppressed. In 2021, the HIV and TB portfolio was transitioned to local partners, including JCRC. And we continue to provide mentorship and technical support, ensuring that there was little disruption to the districts we partnered with, and more importantly, the clients we served. So as everyone has said so far today, it's really been quite a journey. I'd really like to thank USAID for the partnership and support, the government of Uganda, including the Ministry of Health, and other government ministries, including local government officers, civil society and local partners, friends from JSI, who did such hard work in implementing this project, and our implementing partners. Thank you all for the privilege of allowing us to work with you.
Thank you so much, Ndugu Mark, for those wonderful remarks from JSI. I am privileged to have broken my teeth of hosting and moderating events with the support from JSI when I was with Mr. Alex Mugume. And it was during the STAR EC, and I was with your president, Ken Olivola. Yes, so I have been a part and parcel of the family. I've seen the JSI story, and Dr. Pamela and Mr. Medi can testify that the work we've done in Lango sub-region has taken Uganda to the next level. So we thank JSI, and we pray that the Lord Almighty blesses you. We can clap, members. Yes, yes. Allow me at this juncture, without much ado, to invite a lady who is so passionate about health services in Africa, a lady who has traversed the hardest reach parts of Uganda. I shared with you that we traveled to Karamoja in the deepest part where we have the Ik community, the most vulnerable community in Uganda, and she reached there and said that we should keep supporting Uganda. That was over 10 years ago. I'm happy to welcome you back and to say this is your time. My sister, Alithia Musa, please kindly come on behalf of the USAID Office of Health and HIV/AIDS. Thank you.
Thank you. I have the opportunity to say good afternoon. So, Director of Clinical Services, district officials, regional referral hospital directors, implementing partners, representatives of our civil society organizations, colleagues, and distinguished guests. The United States government, through the United States Agency for International Development and other U.S. government agencies, has been working and providing funding and technical assistance to Uganda's health systems for decades. These investments have saved lives, created healthier communities, and strengthened systems to better respond to outbreaks, all while putting people at the center of care. Together, we have worked to bring the HIV pandemic under control. Together, we have worked to combat malaria and TB. Together, we are improving child and maternal health, and the United States stood together with the Ugandan people, supporting the country's response to the COVID-19 pandemic and the recent Ebola virus outbreak. I am incredibly proud of our collective achievements in improving the strength and resilience of Uganda's health system. Through the 5 regional health integration and enhancement service activities, more commonly known as the RHITES projects, we have made significant strides in increasing access to quality health services for the people of Uganda. I would like to highlight some of them here today. 500,000 Ugandans living with HIV/AIDS now have access to life-saving antiretroviral treatment, with 94% achieving undetectable viral load. Thanks to our collective work, over the past 5 years, close to 700,000 children were delivered at health facilities as compared to just 120,000 in the previous 5-year period, greatly increasing the chance of survival for both mother and child. Immunization of children also increased from 417,000 to almost 680,000, and antenatal attendance within the first trimester increased from just 41,000 to 360,000 as compared to the previous 5-year period, which are all incredible achievements. As part of this effort, USAID invested $11.3 million to enhance health infrastructure like clinics, laboratories, and maternity units. These facilities now serve more people with better quality of care and improve the work and environment for healthcare providers. Over the years, we have also learned that ownership of programs by the district and local actors leads to achieving results faster and supports sustainability in the long run. As a result, we've recently transitioned HIV/AIDS and TB service delivery from RHITES to 7 local partners and 7 regional referral hospitals. We hope to sustain gains made and build a robust health system that is responsive to the needs of the community. We also integrate learning and best practices from the RHITES activities into the newly launched Uganda Health Activity. This activity will increase the survival and well-being of vulnerable populations and improve the resilience and overall health system against shocks and outbreaks. To end, I would like to acknowledge and congratulate everyone who has contributed to these achievements. While these achievements are great, we know we operate against the backdrop of multiple challenges that threaten the gains we've made. Let us continue to work on improving the quality and equity of health services for all Ugandans. Thank you.
Thank you, Alithia Musa, for that wonderful bird's view of the USAID work in Uganda. I think she deserves another round of applause. I was especially impressed that, when you invite these very important people, I didn't know that you can speak all those important things in less than 5 minutes, and everything is covered and everybody is attentive. There are some important people we are used to when they start speaking, people start sleeping. By the time they wake up, the man is still talking, and they don't know when he started or when he's ending or where he has reached. But thank you so much for speaking very well. This is not to put Dr. Olaro under pressure, that on behalf of the Ministry of Health, I'm going to invite Dr. Charles Olaro, who I have already introduced, and I request as he comes through, we give him a round of applause for being here with us as we celebrate these very, very important milestones. Dr. Charles, you're welcome.
Thank you. The acting USAID Director, Office of Health and HIV, and other mission staff present, the RHITES prime partners from the headquarters, from the USA, the URC President, the URC Vice President, the EGPAF Regional Chief Operating Office, my colleagues from the Ministry of Health, commissioners, and other senior officials, the directors of regional referral hospitals and all district officials, chief administrative officers, DHOs, ADHOs, our implementing partners, the civil society representatives, distinguished guests, ladies and gentlemen. As you saw when I went through the protocol, I tried to avoid the names, as the colleague was saying. But I want first to acknowledge all our visiting partners. Let's clap for our colleagues who have visited. When the PS delegated me to represent her here, she did not know actually that she had delegated me already 2 other activities. But you know, when your boss delegates you, you cannot go and tell her that I cannot do one. I had to willingly accept. Augustine did tell me that I need to be here at 11:35, and I think I tried to come actually around that time. When the director of ceremonies introduced me, he said I was a surgeon. It did create some fear factor. But I want to mention that a surgeon is a physician who occasionally uses a knife to treat. So actually, just a surgeon who's a physician. So at this point, ladies and gentlemen, allow me to go through the speech of the permanent secretary. So I want to put a disclaimer from the beginning that if it's long, it's not my speech. It's the one of the peers. So I bring you warm greetings from the Minister of Health, from the permanent secretary. She could not be here due to other engagement, but wishes us well during this wonderful event. I'm honored to stand here before you today on behalf of the peers to deliver our opening remarks on the USAID-funded RHITES Colossia and USAID Uganda Health Activity Learning event. That will mark the end of the 5 RHITES program and the beginning of the new journey of the USAID Uganda Health Activity. Over the past 7 years, these 5 USAID RHITES programs, RHITES Southwest, RHITES East, RHITES EC, RHITES North Lango, and RHITES North Acholi, which was funded by the American people through USAID, have made a very significant impact on the health in our health sector. I think we need to applaud that. I think we all have seen it, and it's really transformed. And sometimes definitely it brings now, when people, initially before the USAID Health Activity was announced, people were saying, now what next? So it really, truly, it's been transformative. Throughout the years of implementation, the program has successfully addressed the key challenges in the areas of reproductive health, maternal, child, and infectious diseases, including malaria, COVID-19, Ebola, and health system strengthening. By collaborating with the Ministry of Health and the local partners who are present here, the regional referral hospital, districts, and community leaders, and the healthcare professionals, the RHITES health programs have fostered a sustainable solution to how positively impacted on the lives of countless individuals and families. And I think these stories are all written all around. Through the dedicated efforts of healthcare workers, the volunteers, and the program implementers, we have witnessed remarkable achievements across the key indicators, access to essential health services has expanded, resulting in improved health outcomes and reduced mortality rates. Our collaborative efforts have also enabled us to strengthen our high-impact interventions, the quality improvement processes like maternal and perinatal death surveillance and response. The implementation of maternal and perinatal death surveillance and response, and implementation of the local maternity and neonatal health systems, which has resulted in a 15% reduction in institutional maternal mortality rate from 108 to 84.7% live births. Let's clap for that again. So what that means that now we need to be able to see how do we sustain and maintain what? That reduction. Because yes, that's not good enough, but we need that acknowledge that we have made we have implemented and been able to achieve what we wanted. We have achieved 36.4% reduction in our institutional perinatal mortality rate from 29.1 to 18.5 per 1,000 live births. I need to inform the peers that they were not clapping very well. Thank you very much. The successes are displayed in the exhibition, I think, which I will also take time to see from the Knowledge Bursar, and encourage you to take a few minutes and visit them once again, even if you have already been there. Furthermore, the USAID RHITES programs have played a pivotal role in strengthening the capacity of our health workers. Training initiatives, infrastructure improvement, and the provision of essential equipment has enhanced the skills, the capabilities of our health workers, professionals, and this not only improves service delivery, but also contributed to building a resilient and sustainable healthcare system. And so that's why you're looking at when we had an Ebola outbreak, the lessons, what you got from COVID, you're able to just transform in and do on, and be able to move. And I think that's what a resilient health system represents. As we gather here today, let's acknowledge that the invaluable contribution of the individuals, and this is key. Sometimes we just look at the end part of, but individuals have had a lot of effort. The organizations involved in the implementation of this, the USAID RHITES programs, and if they are here, we would want to acknowledge them. URC, let's clap for them. I think I will now be asking for claps for everyone. Intra Health, EGPAF, JSI, and their sub-partners, together with the Ministry of Health, the regional referral hospitals, the districts, the civil society organizations, and most importantly, the healthcare workers and the volunteers. Their dedication, perseverance, and passion has been the driving force behind the successes we are witnessing and celebrating today. However, our journey does not end here. The challenges in the health sector persist, and there is still work to be done. We must build upon the foundation laid by the USAID RHITES program and continue our collective efforts to ensure equitable access to quality health care for all our citizens, as is truly USC that leaving nobody behind. Let's strive to sustain these gains made so far and forge ahead with the renewed determinations. So Ministry of Health was introduced to Uganda Health Activity, USAID Uganda Health Activity in January 2023, during which the co-creation and work planning meeting was held. We made our commitments to work with the USAID Uganda Health Activity and this commitment is to all our regional referral hospital districts to welcome and support USAID Health Activity. So I think all of us seated here, represented both from the Ministry of Health and down to the district, we have committed to support the USAID Uganda Health Activity. If you agree, let's clap. So in addition, the Minister of Health senior officials participate in the project regional and district entry meetings to emphasize this partnership. This is an indication that the Minister of Health leadership commitment is assured, and we continue to engage with the Uganda USAID activity and other key stakeholders to ensure that there's smooth running of the project. I'm aware that the project is already working well with the Minister of Health, the Regional Referral Hospital and District, and the critical activities have already been supported in the past 6 months. So when it reaches 6 months, it can now start on supplemental feed, not only on exclusive breastfeeding, so it can be able to. So it's already growing. So this is good and promising beginning. Let me take this opportunity to congratulate the university research and their consortium, the EGPAF. Let's clap for them again. FHI 360. The Communication Foundation to Uganda, Youth Alive Uganda, Maristops Uganda, and Panagora Group for winning this award. We really need to clap, because I'm sure there were many competitors. But now the ones who have won, definitely a lot will be required of you. We need to be able to see how do we deliver, but we have to deliver, and we have to deliver together. I would like to express my heartfelt gratitude to the United States Agency for International Development, the American people for unwavering support and commitment in advancing the healthcare sector in Uganda. This one also deserves a clap. So USAID has been a reliable partner, and we appreciate this partnership, which has lasted over 60 years. The Minister of Health is committed to the provisions of high-quality services to all the people of Uganda without any form of discrimination. The Director General has already issued a circular reminding all healthcare workers and other stakeholders in the health sector to adhere to this non-discrimination policy. I did warn you in the beginning that if it's long, it's not mine. But I want to say that as I conclude, I once again want to pledge our commitment as government through the Minister of Health that we shall provide all the necessary support to USAID Uganda Health Activity and ensure that the intended goals and objectives are achieved. I call upon all my colleagues from Minister of Health, the regional referral hospitals and the DHOs and all the other actors to note this commitment we have made to the USAID Uganda Health Activity and provide the necessary support which is required. It's now my pleasure on behalf of the PS to declare this rights closure and the USAID Uganda Health Activity Learning event open. Welcome the USAID Uganda Health Activity for God and my country. Thank you very much for listening.
Thank you very much indeed, Director, for those powerful remarks. The significant 15% reduction in our institutional maternal mortality rate is extremely phenomenal. The 36% reduction in the institutional perinatal mortality rate is a journey that we've trekked with our various partners, and we thank the RHITES that are closing out, and to our UHA colleagues now we can see the task we have right ahead, as the director has indicated, in ensuring that we maintain and do more. Directors, you indicated for the 6 months that we've had UHA with us, Ministry of Health, we've managed to deliver to some significant deliverables. We started a journey on the local maternity and neonatal systems, which are our regional catalytic service delivery mechanisms aimed at strengthening accountability. 2, improving multi-stakeholder coordination and collaboration. And 3, enabling resilience and responsive healthcare system. Since UHA came in, we've managed to expedite and strengthen the delivery of the local maternity and neonatal systems in the 7 regions that UHA is present in, and they have significantly supported the secretariats of these local maternity and neonatal systems. Of course, the regions that don't have presence of UHA, we still continue to have some challenges, but with your continued guidance, we will see how to navigate that. The National Safe Motherhood Experts Committee, NASMEC, which you chair at the Ministry of Health, you guided during the annual health sector performance review that we needed to have it regionalized. And we went further ahead to engage UHA since they came in to ensure that at least within the 7 regions that UHA is covering, we have the NASMEC presence across the different interventional subcommittees addressing preeclampsia, PPH, birth asphyxia, obstructed labor and safe birth, family planning, and safe anesthesia. So the 6 months have enabled us to ensure that we have significant presence in those various regions. Thirdly, we have, as you are aware, you flagged off a national IMOC assessment, and this happened a month ago, and it's with the support of UHA in the 7 regions that we are trying to expedite and ensure that this national assessment that is going to give us a clear picture on the current presence of IMOC services in those regions is undertaken. So we managed to have some significant resources channeled to this activity, and we are quite sure that within the next small period of time, we should be able to have this completed. The Essential Maternal and Newborn Clinical Guidelines, this is, we call it the Bible of Maternal and Newborn, which continues to guide frontline health workers on service delivery at the frontline of care, decisions on what you need to do next, but you have that tool available. We've managed to undertake, with our collaborative and close working relationship with colleagues from UHA, to undertake a significant rollout across the 7 regions that UHA is supporting. All this has been achieved within the 6 months of their existence since the launch. We continue efforts on the maternal perinatal death surveillance and response to ensure that we have this quality improvement practice well strengthened, and we've also accomplished the rollout of the focused antenatal care guidelines across the 7 regions. Lastly, Chair, we've managed to ensure that some of the quality improvement practices are quite well strengthened in the 7 regions, and this includes the identification of high-risk pregnant mothers, which we know that has been one of the loopholes we've had that has contributed or was contributing to preventable maternal and perinatal mortality. Colleagues, with that brief of what we've managed to deliver for the past 6 months since UHA was launched, allow me now to invite Augustine, who is going to introduce to us the core team of UHA. Dr. Augustine, please, over to you.
In December 2022, the United States Agency for International Development in Uganda awarded the University Research Company and partners a 5-year cooperative agreement to implement the USAID Uganda Health Activity. The USAID Uganda Health Activity will work to increase the survival and well-being of marginalized populations and improve the resilience of the overall health system in 67 priority districts and 5 cities across 7 sub-regions of Acholi, Ankole, Bogisu, Busoga, Karamoja, Kigezi, and Lango. Of these, 42 districts will receive support for health system strengthening interventions, and 30 districts will receive support for health system strengthening and family health interventions. The USAID Uganda Health Activity will work in these districts to improve the health and well-being of vulnerable and marginalized populations and improve the resilience of Uganda's health system by improved access to and use of quality health services at the community and health facility levels, enhanced local ownership and leadership for sustainable health outcomes, strengthened health systems at the regional, district, facility, and community levels. The first result area will focus on improving the quality of nutrition, reproductive, maternal, child, newborn, and adolescent health services in 30 districts. Through this intermediate result, Uganda Health Activity will support national and regional level continuous quality and improvement activities. In addition, the scale of primary health care and community health interventions will be increased, and the ability of the districts to quickly detect and to respond to outbreaks will be strengthened. The second result area will focus on improving local ownership and accountability for health in 67 districts and 5 cities. In addition, it will build the capacity of local PEPFAR partners and government-to-government mechanisms. The third result area will focus on improving health system resilience in all 67 districts and 5 cities. Specifically, this will improve respective district capacities in leadership and governance, health financing, information systems, human resources for health, HRH, and the supply chain. The USAID Uganda Health Activity will also implement cross-cutting activities with a significant focus on building local capacity and amplifying the voices of vulnerable and marginalized communities to demand quality health services. These will focus on gender, youth and social inclusion, development of local capacities, local ownership and accountability, and sustainability. Uganda continues to face challenges around achieving suboptimal family health indicators. Furthermore, social norms and trust in the health system vary with different sub-regions. Building on the achievements and lessons learned from the USAID Regional Health Integration to enhance services, the USAID Uganda Health Activity will use a district-led implementation approach to ably achieve results. The Uganda Health Activity, however, will be different from the USAID RHITES mechanisms, as it will mainly focus on family health interventions that include maternal and newborn health, child health, nutrition, family planning and reproductive health, health facility water, sanitation and hygiene, WASH, malaria, and pandemics in the priority districts. The other unique areas of implementation under the USAID Uganda Health Activity will be the inclusion and setting up of officers in the Kigezi and Karamoja sub-regions for effective implementation, differentiated intervention packages for regions and districts in Uganda based on need, inclusion of support for public finance management, a scope refined towards marginalized and vulnerable groups, including gender and youth. USAID Uganda Health Activity is committed to supporting the Ministry of Health in closing policy to action gaps, strengthening health service delivery networks by building the capacities of regional referral hospitals, district health teams, community-based organizations or CBOs, and public and private sector health workers, and effectively engaging communities in supporting service delivery, behavioral change, and use of accountability mechanisms to ensure the resilience of Uganda's health system. The USAID Uganda Health Activity will be implemented by the University Research Company, URC, as the prime partner, and will be joined by a strong local and international consortium of partners that have an in-country presence supporting various health programs. These partners include Communication for Development Foundation, Uganda, Elizabeth Glaser Pediatric AIDS Foundation, FHI 360, Mary Stops Uganda, the Panagora Group, and Youth Alive Uganda.
Thank you very much indeed. Ladies and gentlemen, that's the journey we are embarking on. Director, it's very important for to note that when we started the NASMEC journey in 2020, we worked very strongly with the USAID MCHN activity. And we are delighted to have in our midst Dr. Nathan Tumwesije, Chief of Party, and the Deputy Chief of Party, Dr. Kajimu Richard. In terms of regionalizing these efforts, we have an opportunity to ride on and leverage and ensure that we reach the last mile. At this juncture, ladies and gentlemen, allow me to invite Dr. Augustine.
Thank you very much, MC, for the UHA highlights. Different speakers have made commitments, and these commitments directly translate into pressure to the UHA team to deliver the intended results. I have the pleasure, ladies and gentlemen, to introduce to you the Dream UHA team that is going to spend a couple of sleepless nights for the next 5 years to ensure that the objectives are achieved. So I'm going to call upon all of you who are mentioned to come here. I will be leading the team. I'm Dr. Agustin Mwezi. I've worked with USAID programs for 20 years, and I'm still going on. Thank you. So if I mention your name, please come forward. People need to see you. Next, please. We have Dr. Robert Iriso. Robert, please come forward and stand there. Dr. Robert Iriso is the Deputy Chief of Party in charge of regional implementation. Next is Dr. Edward Butarakwate, a veteran, and is the Director for HSS and HIV and also Deputy Chief of Party. I have Dr. Aran Katamba Semakura. All of you know him. Former DHO Ruka is the Director Integrated Health Service Delivery. I have Juliana Nabwile Sali, a veteran in QI. She's the Director Quality and Equity. I have Mebo Namwavira, Director Community Systems. I have Brenda Narwada, Director Monitoring, Evaluation and Learning. I have someone who is in charge of finances and administration. Finance and Administration Director, Patrick Nyacheo. He's the one in charge of resources. I have Joseph Duku, who is the Senior Human Resources Manager. Come forward, Joseph. I have Fred Wangoro, Senior Operations Manager. I have Nicholas Nsubuga, who is not here, who is the Compliance Manager. His job is to ensure that the UHA resources are used properly. And if we don't adhere to his directive, then we can actually have problems. We have regional directors, regional program directors. Let me start with Dr. Judith Arroyo, who is in charge of Guru region. I have Dr. Beatrice Aber. She's in charge of Ankole region. I have Dr. Andrew Ochero, who is the Regional Program Director, Bugisu region, but also the surrounding sub-regions of Bukedi, Sebei, and he is also the UHA technical lead on One Health, so he will be in charge of pandemics as well. I have Dr. Felicite Nahataba, the Regional Program Director, Busoga region. I have Dr. Josen Chigundu, the Regional Program Director, Karamoja. I have Dr. Linus Amando, Regional Program Director, Lango. Chigezi, not Lango. And finally, I have Dr. Damasco Wamboya, the Regional Program Director, Lango. So this is the senior leadership for USAID Uganda Health Activity that is going to work very, very closely with the Ministry of Health, with the regional referral hospitals, with the districts, to ensure that we achieve the intended goals. The regional offices are semi-autonomous. We've modeled our setup to the MOH setup. So they are semi-autonomous. They plan and implement their activities autonomously. The small Kampala team monitors what they are doing. They have their separate accounts, they have accountants, they implement activities, make their own payments. Our duty as the Kampala team is to ensure that they comply to the URC internal procedures and policies, but also adhere to Ministry of Health guidance. Thank you very much. Over to you, MC. Let me also join the team for the photo opportunity.
Dr. Augustine, that was my job to invite you to join in. But since you've mentioned, I'm also going to request that we'll have the URC representative, the EGPAF regional director. You can also join in. After that, we'll have the Intra-Health chief technical officer. You'll be joining in for a photo moment with the team. CDFU will be joining in. We'll be bringing in groups. Youth Alive, Panagora, Mari Stops. So please, let's first start with the RHITES HQ representatives to please come and join in. I'll also request Dr. Olaro to please join in. Alethea Musa, please, you could also come and join the team. The JSI director for International Division, please. Oh. Yes, Robin Asempebwa, the Deputy Office Director for Health and HIV/AIDS. Thank you for representing USAID. Okay. The camera team. The UHA team can be excused. The rest of you will remain. The UHA team, the chiefs of parties that were introduced, you can please take your seats. The rest of you remain. I'll invite CDFU team to please come and join these dignitaries. And after CDFU, we'll have Mari Stops. The regional referral hospital directors, you'll be coming in next. Please stand next to your sister for a family together. All right. Panagora, you can come in. Youth Alive will be coming in next. Mari Stops. Let's have the photo moments. Okay, I'm going to invite the 5 RHITES chiefs of parties and their deputies. We have RHITES North Lango, RHITES North Acholi. We have RHITES Southwest, RHITES Eastern, RHITES EC. And EC we have Dr. Nathan, who started off the project. You'll join in as well. We have Okay. Please, with your deputy chiefs of parties, we want you to be on record that you've done an extremely wonderful job. After the RHITES chiefs of parties, I'll invite the regional referral hospitals directors. Thereafter, we'll invite the DHOs that are here. Okay, we shall have now the regional referral hospital directors. The regional referral hospital directors. Since these are the regional referral hospital directors, you will stay there a bit so that the MOH team also joins you. Okay. All right. All right, the next we'll have the chiefs of parties for local partners. The chiefs of parties for local partners, please come through. Let's be apt as we come through. And the chiefs of parties for local partners will also include the service delivery team. That is UPMB. IDI, where are you? Please join us. Dr. Mary. Oh, you're there, very good. Above site, you said implementing partners. That is UHSS, MCHN, FPR, sites, supply chain strengthening activity. Let me request that you all come through. SBCA, MRA, Mr. Benjamin, and the team. Okay. Are we in? Okay, you can come. We are now going to have the regions, the district local government representatives from the various regions. Because of the numbers, we are going to come by region. So the Chief Administrative Officer and your team, we shall start with Eastern, the districts of Eastern, that's RHITES E. The RHITES E team, please, that's Mbale, Bukedia, and Moroto. So Karamoja region, please come through. And as you're coming through, the Busoga region, that's RHITES EC, prepare yourselves to be coming through. You'll bear with me. We are doing this because we were supposed to have a group photo, but looking at the numbers and the space we have decided to zone the picture taking, just like we zoned the projects into the RHITES. I think that's the RHITES E team. RHITES EC, hold on a bit. We finish with the RHITES E. That's RHITES Eastern. These are the district local government partners. These are the would-be grassroots support and beneficiaries, stakeholders. And their being here is a sign that the projects worked closely, and it's a stamp of a vote of confidence. And coming here to take a picture means that they are confident that what was done is of great value. Thank you. I'll invite the RHITES EC, that's Busoga region. Busoga region, for the benefit of some of our visitors from the United States and Europe, Busoga region is where the source of the Nile is, and it is in the middle of Uganda. And I encourage you, if you hear of Nyege Nyege, you know that is where Nyege Nyege comes from. This is the district, these are the district officials from Busoga region, and we want to appreciate the support over the years. And you've worked closely with USAID, and we appreciate the support from the district leadership, from the various districts from Busoga region, and they were being supported by the RHITES, the USAID RHITES EC project for the last 7 years. Those of you who are online, we appreciate you. We've noticed there's been a beehive of activity online, and we thank you for keeping the online platforms busy. We've been following you, and we see that you've really attended the entire event. We appreciate. Thank you so much, the EC team. Let me now invite, we are going to first go up north. I'll start with RHITES Acholi, the RHITES Acholi team. That's RHITES Acholi district leadership. Please come through. The districts of Acholi. Acholi region is bordering with South Sudan and bordering with Lango and bordering with West Nile, and also has an opportunity to border with Karamoja. So they are both international and local governments.
Surely team. Apoyo Bino, Apoyo Matek. All right, thank you. We'll now have the Lango District Local Government teams that are here. That's the RHITES North Lango projects. The district leadership from Lango. The Lango team, we want to welcome you to Munyonyo. My brother, you're very welcome, Mr. DHO, for Lira. I encourage you, please visit Lango when you get time. It is one of the most interesting places in Uganda with a full and rich history and very wonderful, wonderful places. Some are hard to reach, but the services were reaching everywhere thanks to the collaborative support from the district leadership and the project staff. That was led and headed by JSI. All right. We'll now slope down to southwestern Uganda, that is Kigezi and Ankole. The districts of Kigezi and Ankole, please come through. The leadership of the districts of Kigezi and Ankole, please come through. I don't know if you'll fit there, but let's try. And as we take the pictures, I would like to request that if you attended and did not register, please kindly make sure that you register at the entrance. Please make sure that you register at the entrance. I would like to, Dr. JP, where are you? Dr. JP. I wanted to say, oh, you please come and take a picture as the MCs with our chief guests. And before that, we take I will request that the AORs will finally come because you're the technical representatives who have been ensuring that projects are run on time, within budget, and with resource utilization that is at its maximum. And you'll be the last team that we'll be having pictures with. And I'll just have a small announcement to make, and we'll be good to start the next and final part of today's deliberations. All right, thank you so much. Let me request that we take our seats for just some small announcement. The RHITES North Acholi team, your boss has requested that you stay around briefly. The RHITES North Acholi team, you'll stay around briefly for a small discussion with your team. And all URC staff have a brief meeting with the URC HQ team after lunch at 2 p.m. in this hall. All the URC team, please kindly note that you'll have a meeting in this hall after lunch. Please do not leave. So I'd like to thank each and every one of you that has managed to attend today's event, the UHA for taking lead in preparations, and the 5 RHITES, USAID RHITES projects that have successfully transitioned from RHITES, the UHA activity. Would like to thank the American people through USAID for supporting the RHITES mechanism and attending the event. Would like to also thank the presenters, the various people that came here to speak to us, the panelists, the presenters. You did an amazing job. Let me also take the opportunity on behalf of the organizing team to thank the Ministry of Health for honoring this event. We thank you so much, and please extend our gratitude to the PS, Ministry of Health. The invited guests, including the implementing partners, the regional referral hospitals, district leadership, CSOs, thank you so much for coming to be with us today. I would like to encourage all the guests to pick your knowledge management products, including soft copies, as a last mile. Thank you very much indeed for coming today. Let's continue to work as a family and to journey as a solid family, because we can only deliver as a team. Enjoy your lunch and have a good day. Ladies and gentlemen, the USAID RHITES and UHA learning event has come to an end. Let's go in peace, enjoy ourselves. God bless you. I remain Moses Karugawa, yours truly. Goodbye. The Lango district leadership, the Lango district leadership, and partners, we request that you can come. You have a small meeting here. The Lango district staff and partners. Thank you. If you haven't received your coupon, there is a table that was having registration towards the end. If you do not have a lunch coupon, please get it from there. And if you've not registered, please kindly register. We please request that you register. Thank you. Acholi district leadership. Acholi district leadership and staff of RHITES North Acholi. Acholi district leadership and staff. We are meeting in that corner. We are meeting in that corner. just remind us, please, if you've not registered yourself, please do not forget to register. And lunch will be served in the big tent as you get sloped down from Victoria Hall. Thank you.